Hi, my name is Eli Paul,
My name is Honest Elfor.
and our research looked at the lack of reporting guidelines and clinical trial registration in physical medicine and rehabilitation. Research surrounding physical medicine and rehabilitation is growing, but previous studies have shown that the quality of evidence regarding research in physical medicine and rehabilitation is deficient. And this can be attributed to poor methodological quality of the research and lack of reporting guidelines. Reporting guidelines and clinical trial registration have been shown to improve scientific research by limiting bias and promoting transparency.
The overall purpose of our study was to assess the top 100 journals in physical medicine and rehabilitation to determine the requirements or recommendations for authorship use of reporting guidelines and clinical trial registration.
The top 100 journals in physical medicine rehabilitation were selected using the 2021 Scopus Site Score tool. For each journal selected, we sent a standardized email to the editors inquiring about what study designs they do not accept. And then, in a blind duplicate fashion, Honest and I explored the submission guidelines of each included journal for data extraction. And in figure one, you can see our Prisma flow diagram demonstrating the journal selection process. You can see that of the Scopus Site Score tool, there were 129 journals in total. And then we selected the top 100. And then of the top 100, we had to remove two because one was not a journal and then the other had their publication ceased. And then so we added the next two highest ranked journals, giving us our top 100 physical medicine and rehabilitation journals selected for data extraction.
As for Figure 2, this shows a pie graph representing the top 100 journals and their degree of reference to clinical trial registration. Figure 3 also shows the same top 100 journals and their degree of reference to reporting guidelines. Overall, our investigation into the top 100 journals of physical medicine and rehabilitation found that the majority of journals do not require reporting guidelines and only half of them require clinical trial registration. Furthermore, we found that mentioning of specific reporting guidelines to be largely variable. Journals should adopt more rigorous policies in regards to adherence to reporting guidelines and clinical trial registration in efforts to enhance research within the field of PM&R.
Given the position research takes in clinical decision making, it is to the interest of all parties that journals ensure the research that they publish to be of high quality. Adherence to reporting guidelines and clinical trial registration have been shown to improve the quality of evidence based medicine. Our references can be seen within the QR code, and we would like to thank and acknowledge Mr. John Goodell, our medical librarian at OSU CHS, for his time and efforts that he invested into our research. Thank you.